My initial symptoms for hyperhidrosis started with sweating when I started going through puberty. I noticed that I was sweating abnormal amounts under my underarms, and then it slowly moved to my hands and feet also. So mainly just sweating more and more frequent and in different situations rather than normal. I would sweat even when I was just sitting still. I first became aware of my symptoms when I was around 12 years old, right around when I started to hit puberty. I noticed that I was sweating more, and then it wasn't until I was 20, about 22 or 23, when I started getting curious about really what it was, and then it was just last year when I was 26 when I got my first diagnosis. Starting from when I was younger, having hyperhidrosis, I never really thought to go to the doctor about it until I was like midway through my teenage years. And I always talked to my mom about it. I told her, you know, I feel like I'm sweating a little more than usual. But she didn't know that it was a condition either. So she would buy me all the different kinds of deodorants. We would try different topical medications, just stuff that you can get at like Walmart, you know, or the pharmacy. So she would always try to encourage me, you know, saying, we'll get through this. I don't know, you know, what's wrong, but maybe your body just doesn't like that kind of deodorant or something. So we were always trying new products. It wasn't until high school when I would tell my friends, you know, that I think I sweat a lot more. I don't really know what's going on. And they would just kind of try to comfort me through it and say, you know, it's not that big of a deal. You know, it's not noticeable. And then once I got older, I found my fiance, and he would always try to encourage me. He didn't know what it was either. No one in my life really knew what hyperhidrosis was. So he would always tell me, you know, why don't you go see somebody about that? Why don't you try to figure out what it is? And I just kind of brushed it off for the longest time because I was like, I don't think this is anything. You know, I think I can use medication and try to fix it. And I don't know even if I told a doctor if there's anything they can do about it. So it was about last year when he was really like, you know, let's go to the doctor and see what this is. So he made me feel really comfortable about actually going to the doctor and getting my diagnosis and everything. So he's been a really big support system in my life. For treatment options, my dermatologist recommended that I try, I think it's called Rubinol, an oral medication tablet that I took. I took it for, I want to say 5 or 6 months, and it caused really bad dehydration. It caused my whole body to dehydrate, and I was just super uncomfortable, caused me to have dry mouth, so I didn't really like that option. And then we also tried a topical medication. It's a topical liquid that you apply to your underarms and your hands and feet. And that one caused me to get rashes and burned really bad, caused a lot of skin irritation. And then the final option that they've been talking about is getting Botox in my underarms and possibly my hands and feet. But my insurance hasn't approved that yet, so I haven't got to try it.